Welcome to KMIT Vista. In this today's session, in the third unit, we will be studying about artificial intelligence in management of COVID. Artificial intelligence in the management of COVID. And so government have made some policies or some management things to detect and avoid COVID or to reduce the severity of COVID. So they used one method called methods by using AI techniques. AI techniques have been evolved in various areas of coronavirus pandemic, which include first one, AI in early detection and alert system, AI in tracking the patients along with predictions, AI in diagnosis, AI in treatment, AI in cure of diseases, AI in obtaining the status and the number of related numbers related to the disease using dashboard, AI in social safety, surveillance and preventions. In these areas, AI management has been done. So we'll see one by one. In AI in early detection and alert system, a cluster of pneumonia patients were emerging around the fish market of the Wuhan, China, spotted with a technology called as Bluetooth. After approximately 9 days, the condition was recognized by a World Health Organization, which declared a warning statements in 2020. The attack was aggregated as COVID-19 and later was discovered as a pandemic outbreak, considering the spread on severity of the cases around the globe. Here they used one technology, one is called as Blue Dot technology. Blue Dot is an organization that was launched in Toronto, Canada, which involves a panel of qualified personals like physicians, epidemiologists, veterinarians, software developers and data analysts along with scientists from different fields. So the personnel utilized the NLP as a tool to generate artificial response and further optimize the process on big data in a limited time. This technology can grab information from various sources like digital media. They started taking the data from the airline tickets. They started on population democracy. They started taking the data from the livestock health reports, and they have developed all data is collated into one database, so that they started on the database some processing techniques. They applied some processing techniques to create a solution, to generate a decision making. Working of the Blue Dot, it has been an extensive software which gives a service to locate, predict and trace the spread of virus around the world. Blue Dot engine accumulates the data over the 150 diseases and syndromes which were registered throughout the world. So all the syndromes and the diseases of 150 are accumulated in a registered portal where throughout the world, so that they, based on the engine's data, they started predicting the variants of the disease. By providing the official data, it also extracts the information of billions of passengers traveling through the various routes, animal to animal population data and the information from the journalists, media and healthcare workers. Based on this, all the information, first one is animal to animal information, population data based on the information of journal media and healthcare workers. All these are processed to classify the data manually and creates a taxonomy for further learning activity. So by giving a proper input of the data, it provides a handy data and specific topic or a case, and is also able to produce suitable traces for the need of investigations. It can also present recent or live updates to give an alert to the for the troublesome circumstances, thereby looking a preventive action. So here in COVID-19, the blue dot system with the blue dot experts have sensed and flagged the Wuhan city rightly as the hub of the virus outbreak. It even anticipated the places like Bangkok, Tokyo, Phuket, Singapore as the area prone to develop infected conditions. This is not the first time the involvement of the technology was evident. Even the previous years during Zika virus also it is an outbreak. So later they started using AI in the chatbots. So in the recent times, the WhatsApp has emerged as a routine in our every life. So WHO has selected the WhatsApp and launched a chatbot which gives an prior information regarding the COVID-19. There are frequent updates in the tool that provides the latest information via audio or text methods regarding the COVID message. In the COVID time, whenever we call somebody, we use it to listen about the precautions that we have to take in the COVID. So here also whenever WhatsApp, when we do WhatsApp, again it throws a reverse message that how to take the precautions of the COVID. So the users have been options to share the views and opinions at any point regarding the COVID pandemic. This approach have been developed easiness by maintaining the transparency about the among the billions of people all over the world to have the uniform relevant information. The most important thing that happened in COVID is all the countries had only uniform data because of AI on the disease. The chatbot includes the most advanced information related to the symptoms, preventive measures, and also the difference between the symptoms and regular flu and also the COVID-19. Additionally, it provided a live update on the count of the current coronavirus suffers to help the government, health workers, caretakers and decision makers, which helps in efficient policy making. Later they used, our government have created one app called as Arogya Setu. In India we have used this Arogya Setu app. It was developed by the Ministry of Electronics and IT of an Indian government. Was developed an app for making the citizens aware of the pandemic situations. The app includes the risk factors and prevent the steps to avoid the infection. Later, it also helps users to undergo the self-assessment to know their status, health status. This app is also available on the Google Play and App Store for Android and iOS application. How the app worked? So Arogya Setu, we know that it is a Bluetooth enabled app. Keeps tracking about the user information with enough information just in the case if he or she comes near to the person of COVID positive, so it has alerted the person. So the Bluetooth technology and the live location features enable the tracking of an individual location and generates a social graph which shows the interaction between the several people, so that if one person interacts with 10 people, it also tells about how many people are there who has COVID, so that we can maintain the social distance. So after installing, the process is done. The user allows the Bluetooth and location sensors to activate and set the permissions on the continuous tracking. The app also conducts a survey recording to the COVID-19 and ask various questions related to the personal symptoms. The report is forwarded to the government to keep them updated. While collecting the data, the app also senses the infected persons moving around them and immediately warns or alerts the user to get isolated and to a safe place. The data remains confidential with an access to the government and the user himself. Uses himself. So in COVID, they used the Bluetooth technology, they used WhatsApp chatbots. Later, the Indian government used Arogya Setu as the app so that people started creating dashboards, people started alerting system, people started messaging system, people started recommendation systems. So different types of applications have been developed in the COVID-19 so that all our prediction systems which are involved with our AI technology. Thank you.